Welcome to South Florida Hospital News and Healthcare Report. We're here at the South Florida Hospital and Healthcare Association Summit meeting, which is really about nursing, but an interesting product that my friend Sam we ran into, didn't even know he was going to be here, about what he has for hospitals, healthcare organizations, assisted living facilities, nursing homes, a product that everyone should at least have or consider for their operation. Sam, welcome.
Good to see you, Charles. Thanks for having me. So, everyone in the industry right now seems to be talking about our nursing challenges and the challenges that our nursing teams are facing, as well as the shortages. So, our whole premise is working smarter, not harder. And we're doing that by employing new technologies, including artificial intelligence and a lot of the digital technologies that we've become so accustomed to in our pocket on our smartphones every day. So what we've done is we have a nurse call system that is built in.
Let me work over here so we can take a look at it.
We've got a nurse call system that's built into a bedside patient tablet here. And so this is the patient's entertainment device. It's their hub. It's their entertainment. It's for calling the nurses, but it's also for calling all of the other things. So ice, water, all of these calls today are coming in through the nursing team. The nurses are taking these calls and then having to route them to the teams best appropriate for serving that need. We said, don't bother the nurses with that. Let's send these requests to the teams that are best suited for fulfilling the requests, and let's leave the nurses to do their job. So out of all of these requests, just one needs to go to the nurses. The rest will go to the orderlies and to the other teams, and allow them to fulfill that request quickly and expeditiously, so the patient has a better experience and the healthcare team also has a better experience.
In what environment, as far as a hospital, give us an example on a hospital situation, patients in the room, need some help or something, show us how easy it is for them to be able to do that.
Right. So over here, if the patient has a request or needs to call for help, they can simply hit the call button. Has visual lighting cues as well for the hearing impaired. But if you look over here, this call has just come in on the nurse call board. There's a few different views. There's the visual nurse call board, which is streaming video, allows the nursing staff to watch and monitor up to 12 patients at a time. That's used for remote patient monitoring as well as for nurse call. But then there's also a more private view where the call comes in as well. From here, the nursing staff can select that and then choose to send the message to the patient, open up a two-way video call with the patient, or simply check in and see what's going on with that patient to make sure that there isn't an emergency. What this does is it slows the nurse's day down. It allows them to, so now we have a live view of what's going on in the patient's room. So this slows the nurse's day down. Let's say your nurse is in the middle of administering something to a patient and a call comes in. We don't want them to have to drop what they're doing to come attend to that patient. This allows them to check on the patient from their smartphone in their pocket, from a tablet device, from the computer on wheels, or from the nurse's station, and have that two-way video-rich experience without having to take off PPE, go to the patient's room, put PPE on, oh, you need water, and then do the whole thing over again. So it's giving the patient the nurses some of that time back in their day.
Which again enables nurses to have more quality time with patients rather than remedial type stuff to be able to do. So with that, you're actually stretching out the nurse to take care of more patients than they could before by having people take care of what I would say the routine situations that didn't require an RN degree or a nursing degree.
Exactly. It slows the nurse's day down, allows them to focus on the quality of care that they're providing, and allows other teams to handle all of these other things that they're there for. So our nurses are now focused on what the nurses are trained to do, while the rest of the staff handles the other things. Then these devices, since they're at the patient bedside, they're also being used, say, for pre-discharge care instructions. Instead of throwing all this information at our patients just before they're discharged, and they're confused, there's a lot of info there, now we can give them the education that they need based on their condition prior to them leaving, well in advance, to make sure that they understand their post-acute care instructions and reduce readmission rates.
So it serves as an educational tool for the patient and also as a call, what I would say a call button on steroids.
Absolutely.
Because when you're in a hospital now, when you have a call button, it's one red button. That's all you got, and you, like I said, it goes to the nurse, and the nurse has to disperse people.
Right.
Here is a totally different solution.
One other scenario that we're seeing is, physicians are also stretched. So we've also got virtual rounding built into this. So right here at the patient bedside, the nurse can initiate a two-way video call with the physician. The physician can call into the patient's room and do virtual rounding. We can do telehealth. It handles all of these different functionalities all through a single platform.
So actually, this product that you developed was developed almost like right before COVID,
Yes.
per se. And then all of a sudden, when COVID hit the United States, the product became even more important because of the ability to be able to see patients.
Absolutely.
And I think with that, people understood that now you don't need to necessarily be in the room 24/7. You can monitor the patient in an effective manner.
That's just it. Yeah, when COVID hit, we really wanted to solve three problems that we were hearing about everywhere. PPE utilization was through the roof, and there was a scarcity issue. We needed also then to protect the health of our healthcare workers as well as our patients who were at risk. And we needed to have a mechanism to connect patients who were isolated, alone, and in the hospital with their loved ones or their mental health care providers outside the hospital. So with this, we have the ability then to initiate a video call with anyone outside the hospital simply by putting in a phone number or an email address. It comes to their smartphone, their tablet, their computer. They get a link, they click the button, there's no software for them to install, and it initiates a two-way encrypted video call real-time with that patient. So the nurses aren't having to play tech support with their patients on an iPhone or an iPad. It's all right there. As far as the PPE goes, we wanted nursing teams and healthcare teams to have the ability to view, monitor, and communicate with the patient without going into the room every time. PPE on, PPE off. There's time, there's cost associated with that equipment. So what this does is that it allows the team to do all of this remotely over video and have a much more rich communication experience with their patients through this mechanism. And then physicians as well, gives them an opportunity to do virtual rounding. 60% or so of the patients that they're seeing, they don't necessarily need to be in the room with that patient. So this gives them some of that time back as well. And then for our at-risk patients, I'm getting other alerts that need to be cleared. For our at-risk patients, we also wanted to limit their exposure to healthcare workers who are around the hospital and may also be a vector point for transmission. So by having these tools, we're limiting that in-person contact.
So in essence, really, when you think about this product, today we are, and who knows where we'll be tomorrow, but today we're kind of stepping out of the COVID situation, people being a little bit more free, but still cautious. I mean, here we are at a conference and maybe 10% of the people are still walking around with masks.
Yes.
So I assume within a hospital, the mask situation is going to continue for an extended period of time. And the feeling is, what else can I do to protect my workers?
Right.
This is a perfect solution to be able to protect your workers even better than before. Even if COVID is really downgraded, you never know what could pop up next. So as we know, this is not a 2 or 3 year, this is probably a 10-year cycle of some kind of COVID or some kind of virus that's going to go within the human strains to be able to happen. So with this, if people installed it now, could be ahead of the game. Absolutely. To be able to make them more efficient.
Absolutely, and you mentioned safety. Safety is at the core of everything that we do, all of the technology. This tablet and this system, this nurse call system, is one component in a much larger, fully integrated safety system. So these devices might look different on a wall. It might look like a digital display in the lobby of the hospital. In the ceiling, it might look like a digital speaker with a drop-down camera, and it has digital signage on it. Those are used for code alerts and for announcements in the facility, but they're also using AI technology to look for weapons. There's an increasing amount of violence taking place in our hospitals these days. They're looking for mask compliance, enforcement of mask policies at hospitals. We can use them for all of these different things. That same AI next to the bedside can be used for fall anticipation and risk prevention. So whereas pressure sensors will tell you after the patient has already gotten out of the bed and may already be on the floor, what we're doing is we're using a combination of telemetry, the camera and the artificial intelligence to anticipate when a patient has gone from a resting state to a wakeful state, and if that patient has been flagged as a fall risk, now the nurses and the CNAs are automatically notified the moment that that happens so that they can get into the room and try to prevent that from happening. We also have the dashboard here that allows them to monitor patients from a central point in the hospital, monitoring as many as 12 patients per board. So one person can have 2 or 3 of these up and monitor a slew of patients simultaneously using video, telemetry, and other
and
factors.
AI to be
and
able.
AI,
So
absolutely.
basically, you as one who's monitoring, if they see some movement, but through AI that says that patient's about to get out of bed,
Right.
okay, versus getting out of bed and then realizing it, they can get an alert as that's happening.
Correct, yes. And the AI is more assistive in that regard. It'll call the monitor's attention, hey, look over
Right.
here, this patient is flagged and
Right.
they're moving. Let's get someone down there before we have a fall. Our goal is really safety. We want to save time, we want to save minutes when seconds count. And so by using the assistive technologies, by using all the technology that's available to us today and applying it to these purposes, we really are saving time and we're getting to things faster and helping the nurses perform their jobs better by giving them the time and the space and the air to do so.
So, kind of wrapping up, tell me why a system wouldn't want one of these.
I can't think of a reason, Charles. I can't imagine. You know, in a time when with social media and smartphones, where I can get a notification immediately when Aunt Sally does something in her garden, I should be able to have that same technology, that instantaneous communication with specific actionable information in my hospitals, in my schools, in my government buildings. The technology is here. We have it. We should use it.
Interesting that your doorbell probably is using more technology than your hospital is using today.
In many cases.
In many cases.
Yeah.
So this would be a great opportunity for somebody to be able to advance their information technology for people within the hospital. Again, patients, nurses, doctors, it works for everybody.
I use the analogy, do you remember when we had our flip phones?
Yep.
And we thought they were Star Trek, they were cool? We could do 2 things with them. We could make phone calls and we could send text messages.
That's exactly right.
The leap that we took when we went from the flip phone to the smartphone is what we're talking about. This is a software-driven platform, so that as time evolves, as we discover new problems that we need to solve, we apply software to it.
You can add to the system.
Absolutely.
You're not buying a system that's going to be outdated. It could be always updated.
Absolutely. All of this is customizable based on the nursing home, the hospital, the school, wherever it is. All the screens, all the functionalities are specific to what that environment calls for. We have an application store on our back-end platform with a digital content management system that allows you to use it for entertainment, for messaging, but also install applications that your patients and your staff can then use. We integrate with the EMRs to give it additional functionality, to eliminate other devices that were rolling around on carts, right?
Yeah, yeah.
So it's amazing in the IP world and in the modern technology world how much further we can take things through software,
Right.
rather than
That's great.
expensive hardware.
Well, Sam, I'm a big fan of it. Now we just got to convince all the CEOs and the managers of different centers to be able to jump into it. And hopefully the show is going to be successful for you. And we look forward to seeing you again.
Thank you.
Thanks
I
very
appreciate
much.
it. Thanks, Charles.
Thank you.